going to talk about asbestos and the Americas. From 1900 to 2008, asbestos consumption in the Americas was more than 43 million tons. Epidemics of asbestos disease have been documented, as we heard from the speakers, in the United States, Canada, Brazil, and Mexico. Elsewhere, the situation is unclear. We just don't have the data. Last year's mesothelioma death of Army Archard has attracted a lot of media attention, but unfortunately the same cannot be said for thousands of people throughout North, South, and Central America who died of asbestos diseases. Current high-profile examples of the residual problems stemming from asbestos pollution include the remediation work at the US Capitol buildings, the Canadian Parliament, and the United Nations headquarters. Well, here's a picture of the UN building, and they are spending a lot of money remediating it and taking the asbestos out. And my conclusion is, it's amazing when there's asbestos in a parliament or in a place that diplomats go to, they deal with a problem. So asbestos exposure, which is too dangerous for the diplomats and the politicians, is not, so we are told, problematic for everyone else. Much of the asbestos used in the Americas was homegrown. From 1900 to 2008, more than 70 million tons of asbestos was sourced from mines in Canada, Brazil, and the United States. We grew it, used it, and sold it. We still do. We were so good at producing asbestos that our output exceeded demand. As a result, millions of tons were exported. Unfortunately, our collective responsibility for spreading the asbestos epidemic is not consigned to the history books. Two of the world's biggest asbestos exporters are in the Americas. In 2008, Brazil and Canada accounted for 21% of total global output of chrysotile asbestos. Asbestos stakeholders in the Americas contribute to the contamination of their own and neighboring countries. Well, how in the 21st century can a substance as hazardous as asbestos be freely transported across national borders? The answer, I'm afraid, is as simple as it is obvious. Powerful vested interests have invested millions of dollars to prevent governments from acting to protect populations. The fact that asbestos industry-funded bodies operate in strategically important countries and that these countries have not banned asbestos is not coincidental. You've got asbestos lobbying groups in the United States, Canada, Mexico, in Colombia, and in Brazil. I'm sure there are others, but these are the biggest ones that we know of. My conclusion about this: vested interests motivated solely by greed continue to exert financial and political pressure to prevent asbestos from being banned. Of the scores of multinational bodies, agencies, and groups working throughout the Americas, evidence of asbestos policies could not be found for any of them, the exception being the Pan American Health Organization that Barry told you about. Here are some of the multilateral agencies that act in the Americas. We have the Andean Community of Nations, we have the Mercosur, which is the common market in South America, we have the Pan American Health, we know about the PAHO, we have regional social security systems, and so on. A search for asbestos on the PAHO website referred users to the WHO 2006 policy. Inquiries that I made on the asbestos policies of other multilateral agencies in the Americas remained unanswered. I sent emails, I got no replies. Considering this lack of response and the data documenting extensive use of asbestos in Chile, in the 7 years before Chile banned asbestos in 2001, they used 40,000 tons of asbestos. There is legitimate concern about hazardous asbestos exposures in the aftermath of the earthquake and the tsunami in February 2010. And this is a photograph that I found on the internet of the destruction after the earthquake and tsunami. And if you can see on the left-hand side, there is something that looks very much like corrugated asbestos cement to me. As far as I know, I mentioned this to Steve Levine, and he said, "Who's looking into this?" Don't know. Maybe somebody should be looking into it. What do I conclude from this? Well, I conclude that global organizations, regional bodies, and national authorities in the Americas have neither acknowledged nor acted on the asbestos hazard. As a result of their malign neglect, millions of Americans have been exposed to the world's worst industrial killer. These exposures continue. Nothing is more important than the sanctity of human life. As representatives from the United States, from Brazil, and from Canada gather together for the 6th annual conference of the ADAO, we affirm our determination to end the misery caused by asbestos. We endorse the statements made in the call to the Americas, ban asbestos now. We reiterate the urgent request made in the call for the Americas for all the Pan-American regulatory bodies and governments to adapt policies calling for asbestos to be banned. We urge the official bodies to work closely with those most affected by the asbestos epidemic, the asbestos victims, in all negotiations and consultations. To end the needless slaughter, an immediate commitment to ban asbestos, accompanied by a detailed action plan for achieving this objective, is essential. The citizens of the Americas have the right to live a life free of asbestos, pain, and death. And to reiterate the sentiments expressed by my dear friend and colleague Fernanda, the struggle continues.